So today we are going to discuss about the fundamentals in cavity preparation. So before starting the root canal, we should be very careful how to prepare the cavity and how the outline, everything should be there. So we are going to discuss about the steps in cavity preparation. Okay. First, we will discuss about the uh, definition. It is defined as the mechanical alteration of a defective, injured, or diseased tooth to best receive a restorative material that will re-establish a healthy state for the tooth, including the aesthetic correction, whereas indicated along with the normal forms and function. So actually it is the mechanical alteration of the caries tooth, which can be to receive a restorative material to make the tooth healthy, aesthetically correction, and also to get a normal forms. Okay. Now comes what is the need for restoration? One is to prevent the caries. The second is replacement or repair of the old restoration due to defect or improper contact, gingival excess, open margin, or poor aesthetics. So if the old restoration is not proper, so in that case you have to replace the restoration. The third point is to restore proper form and function of function to a malformed or fractured tooth. The fourth point is as a preventive sense to reduce the number of microorganism colonization. So bacterial colony may be present in the caries. And last point is a teeth adjacent to the missing tooth may require restoration when RPD or the FPD are designed. So these are the need for the restoration. Need for the restoration means first point is to prevent the caries. The second is if the old restoration is not proper. The third point is in case of tooth is malformed or restoration to get a proper form and function. The fourth point is to prevent the colonization of the bacteria. May be present, that is caries, the bacterial colonization will be there. And the fourth and fifth point is the adjacent tooth of the missing tooth may require restoration when RPD or FPD are designed, because when RPD is placed, there's a chance for the food lodgement or food impaction between the tooth. Okay, so if the tooth is having a small, if the patient is more prone for caries, it is always do a restoration if there is a small caries or anything is there. So these are the need for the restoration. Okay, now comes what are the objectives of the tooth preparation? Why you want to do a tooth preparation? What are the objectives? Okay, to remove all defect and provide a necessary protection to the pulp. So to remove all the defect and to protect the pulp. Second is the preparation should be as conservative as possible. Third point is the tooth preparation such that the preparation in such a way that the restoration as well as the cavity should withstand the force of mastication. It should not fracture. So you should design the cavity in such a way that it should not fracture under the masticatory force. Then comes allow for functional and aesthetic placement of the restorative material. So these are the objectives of the tooth preparation. Now comes what are the nomenclature? Nomenclatures are usually helpful to communicate between the professionals. Okay, it's a set of terms used in communicating among the individuals in the same profession, which enable them to understand one another better. Okay, these are the nomenclature. A lot of terms are there in dentistry. So one is symbol. Symbol means only one surface is involved. Compound means two surfaces, that is class 2, and complex means when more than two surfaces. So for example, in the symbol, class 1 cavity, compound, class 2. Class 2 means MO or DO. but the complex means MOD cavities. Okay. So in the first diagram, it is class 1, second is class 2, and the third one is class 3, that is MOD cavity, that means of course distal cavities. Okay. Now comes the preparation walls. So there are two types of internal wall as well as the external wall. So internal wall, basically there are two types. One is axial wall as well as the pulpal wall. So we'll discuss. And internal wall is a prepared surface that does not extend to the external to surface. It does not extend to the external surface. So there are two internal walls are there. One is axial wall as well as the pulpal wall. Okay. Now comes the external wall. External wall is a prepared surface that extends to the external to surface, such that the wall takes the name of the two surface that the wall is towards. Okay, so the external wall is a cavity that extends to the external to surface. Okay, so that is pulpal floor or gingival seat. Okay, gingival seat is a prepared wall that is reasonably flat and perpendicular to those occlusal force. Such floor may be purposefully prepared to provide a stabilizing seat for the restoration, thus distributing the stress in the tooth structure. Okay, this is not about gingival seat, that is pulpal and the gingival floor. Okay, gingival seat. Okay, so these are the internal walls. There are two types of internal walls, that is the pulpal as well as the axial wall. Rest everything is external wall, the distal wall, facial wall, lingual wall, the gingival wall. Then comes these are the external walls. You can see the gingival seat, semi-enamel junction. So when there are two types of internal walls. One is pulpal floor as well as the axial wall. Rest everything is the external wall. Okay. Now the tooth preparation angle. Line angle is the junction of two plane surfaces of different orientation. Two surfaces. When two surfaces join, a line angle is formed, whereas three angle is the junction of three plane surfaces of different orientation. Okay, so that is the point angle. When two surface comes in contact, it is line angle. When is the junction of three surface of different orientation. Okay, so these are the difference between line angle and point angle. Line angle is the line angle. Internal line angle is a line angle whose apex pointed in the tooth, into the tooth. Where external line angle is the line angle whose apex point away from the tooth. Okay. Okay. So these are the line angle and point angle. For example, I will tell you in case of class 1 cavity, there are 4 point angle and 8 line angle. Okay, so that's the same as for the class 2 cavities. Okay, now we'll discuss about the cavus surface angle. Cavus surface angle is the angle formed between the external wall. So the cavus surface angle should be 90 degree, or other name it is butt joint, because the edge strength of the amalgam is very less. So that is why we are giving a cavus surface angle should be 90 degree. Okay, now comes the classification of tooth preparation. Actually, the classification is introduced by G.V. Black. There are class 1, class 2, class 3, class 4, and class 5 cavities are there. And recently we added the class 6 cavities. Okay, now we goes into the class 1 cavity. All the pit and fissure cavities on the occlusal surface of molar and premolar, Restoration on the occlusal two-thirds of the facial and lingual surface of the facial and the lingual surface of the molar. Restoration on the lingual surface of the maxillary incisor. So one is pit and fissure, occlusal surface of the molar and premolar, to facial lingual surface, facial and the occlusal two-thirds of the facial lingual surface of the molar, and inside lingual surface of the maxillary incisors. Okay, these are the class 1 cavities, where the class 2 cavities, proximal surface. The proximal surfaces of the molar and premolar is involved, it is known as a class 2. And class 3 restoration is the cavities occurring on the proximal surface of the anterior tooth without involving the incisal angle. Whereas the class 4, if the incisal angle is involved, it is a class 4. Okay. The restoration on the proximal surface of the anterior tooth that do involve the incisal lattice are the class 4. Restoration on the gingival third of the facial lingual surface of all teeth are class 5. That is restoration on the occlusal gingival third of the facial lingual surface of all teeth are class 5 cavities. And class 6 is restoration on the incisal edge of the anterior teeth and the occlusal cusp height of the posterior teeth. Okay, this is class 6 cavities occurring on the incisal edge of the anterior teeth and cusp height of the posterior teeth is class 6 cavities. Okay. Now there are what are the stages? This broadly divided into two. One is initial cavity preparation and final cavity preparation. So initial cavity preparation, there are 4 steps, and final cavity preparation, there are 5 steps. Okay, total there are 9 steps out there. Okay, so we will discuss about one is outline form and initial depth, primary resistance, primary retention, convenience form. Then comes 5th, the removal of any remaining infected dentine or old restorative material if indicated, pulp protection, secondary resistance retention form, procedure for finishing the external wall, and final procedure cleaning, inspecting, and sealing. Okay. Now we will go into each steps. Okay. One is outline form and initial depth. Okay. Placing the preparation margin in the position they will occupy in the final preparation, except for finishing enamel wall and margin. So, and preparation and initial depth of 0.2 to 0.8 millimeter pulpally of the DE or normal root surface position. So we are discussing about the outline form should be. So before starting a cavity operation, you should have an outline how to prepare the cavity. So the outline should be in such a way that it should involve all the pit and fissure. Okay. And also we should maintain, the final outline, the outline should be in such a way that the final outcome of the cavity should be same way. Okay. So what are the principle? Principle of outline form is all friable or unsupported. So all the unsupported enamel should be removed. What do you mean by unsupported enamel? Where the enamel is not supported by the dentine, or the unsupported enamel should be removed. All the fault and all the caries, all the defects should be included in the outline form. Outline form is such a way that it should include all the defects or all the caries, and all margins should be placed in a position to afford good finishing. So all the margins should be in such a way that you cannot able to finish it properly. Okay, so these are the basic principle. One is all the unsupported enamel or the weakened tooth structure should be removed, all the defects should be removed, and all the margins should be positioned in such a way that you can visualize properly, you can do the proper finishing and proper restoration. Okay, so This should be in your mind when you do a proper outline. Okay. So what are the features of the outline form? These are the features. So one is preserving the cusp strength. How the cusp strength is preserved by circumventing the cusp. Circumventing the cusp is usually done to preserve the strength of the cusp. Okay, so circumventing the cusp. Then comes preserving the marginal ridge strength. So the marginal ridge should be for the molar, it should be 2 millimeter. The margin ridge for the molar, it is 2 millimeter, and for the premolar, it is 1.6 millimeter. Okay. Normally, in an ideal case, if you will get 2 millimeter, but in some cases where the caries may be extending into the marginal ridge. So in that case, you have to, modify the cavity pressure. That means you cannot able to give 2 millimeters. In that case, you will give a occlusal divergence in the marginal ridge. So this will preserve the strength of the marginal ridge. Okay. So then comes the facial lingual extension. Facial lingual extension, the width of the cavity should be 1/3 the intercuspal distance. 1/3 the intercuspal distance. Okay. Then comes the enameloplasty that we will discuss later. Now comes the connecting two close. If two cavities in the same tooth are very close, that means if the distance between the two cavities is less than 0.5 millimeter, you better join it together. Okay, you should connect the two cavities and make into a single cavity. Okay, then comes the restricting the depth of the pulpal plot should be always keep in the dentine. So that we will discuss. Dentine means the depth of the cavity should be 0.2 millimeter into the DEJ. Okay, so these are the features of the outline form. One is cusp height. The cusp strength means circumventing the cusp. Then comes preserving the margin ridge, 1.6 for the premolar and 2 millimeter for the molar. If it is cannot able to give 2 millimeter, 1.6, we will give a occlusal divergence. The width of the cavity should be 1/3 the intercuspal distance. Enameloplasty has to be done. If two cavities are on the same tooth are very close, if they're so close that the distance is 0.5 millimeter, you make it a single cavity, and the depth should be always placed in the dentine. Why? Because the dentine has got a resilient property that we will discuss in the later. Okay. So what is now comes enameloplasty? It's a prophylactic procedure that involves the removal of a shallow enamel development, fissure, or pit to create a smooth saucer-shaped surface that can be self-cleansed or easily cleaned. Indication: if the defect is less than 1/3 the thickness of the enamel, if we will do enameloplasty. If it is more than 1/3 the thickness of the enamel, we will include it in the cavity preparation. You understand? So enameloplasty is indicated if the depth of the defect is less than 1/3 the thickness of the enamel. If the defect is or fissure is more than the thickness of the 1/3 the thickness of the enamel, we will include it in the cavity preparation. Okay. So in this diagram, the first diagram, the diagram where the defect is 1/3, less than 1/3 the thickness of the enamel. So we will do a saucerizing. We will saucerize it. So it will help it will be in a self-cleansing area. Okay. So there is no need for the cavity preparation. Okay. Now comes the primary resistance form. May be defined as that shape and placement of the preparation wall that best enable both the restoration and the tooth to withstand without fracture the masticatory force delivered principally in the long axis of the tooth. So one of the most resistance features means it resists the masticatory force. Okay, so the masticatory force. So the cavity should be prepared in such a way that it should withstand the masticatory force without fracture. That is known as resistance features. Okay, so now it comes about what are the principles of the So principles is it should be box shape, it should be box shaped and relatively flat pulpal floor, restrict the extension of the external wall to allow strong cusp and ridge to remain with the sufficient dentin support. So one is we should do a cusp circumventing the cusp to preserve the strength. Then comes a proper marginal ridge. All the line angle should be rounded to prevent the stress concentration. If the stress concentration more on the line angle, there's a chance for the fracture of the enamel wall. Then comes extensive tooth preparation. If the caries is extending into the cusp, we will do a cusp capping. And the minimum thickness, enough thickness should be there for the restorative materials. Otherwise, it will fracture and occlusal load comes. And to bond the material to structure when appropriate, we can use bonded amalgam to prevent the resistance. Okay, so when we're talking about the principles, the box preparations means the cavity should be box shaped, the pulpal floor should be flat. Then comes all the cusp capping should be done. The margin should be strong enough. Then comes all the line angle should be rounded to prevent the stress concentration. Otherwise, it will fracture the tooth. And all the cusp cap, weakened cusp should be cap. That is cusp capping should be done. And to provide enough thickness, the restorative material should have enough thickness. That is for amalgam. The minimum thickness of amalgam to resist mastication is 1.5 millimeter. Okay. Then comes to bond the material to structure when appropriate. You can, but for example, we can use bonded amalgam. That is 4 meter bonding agent is used for the bonding of the amalgam to the tooth structure. Okay. So these are the principal resistance. One is box shape, flat pulpal floor. So if the box shape and back pulpal floor is not given for the cavity, there is a chance for the fracture of the cusp as well as the rotation of the restoration. So all these things will result in the failure of the restoration. Okay. Now comes what are the features? One is relatively features. Flat floor should be there, box shape should be there, weakened tooth structure should be included. Okay, preservation of the cusp and cusp, that is circumventing the cusp. Margin ridge for the molar it is 2 millimeter and for the premolar it is 1.6 millimeter. Okay, and rounding of all the line angle, rounding otherwise stress concentration, it will result in the fracture of the tooth. Educate thickness of the material for the amalgam. 1.5 millimeter is the minimum thickness of amalgam to resist occlusal mastication. A reduction of the cusp for cusp. If the cusp with the caries is extending to the cusp, we will give a cusp capping. Okay. So these are the features of the resistance. So we discuss about the definition. Then comes the need for the restoration, objectives of the restoration. Then comes the nomenclature. Now comes the steps in cavity operation, that is the outline form and the initial depth, then principal resistance form. Now will comes retention. Retention means it helps to retain the restoration in the prepared cavity. Retain the restoration in the prepared cavity. Definition: the primary retention form is that shape or the form of the conventional preparation that resists the displacement or the removal of the restoration from tipping or lifting force. Okay. So what are the primary features? One is occlusal convergence, dovetail, and adhesive system. If case arm are composite, we will use bonding agent. So these are the retention. What is occlusal convergence? It occlusally convergence. So this will act as a it will help to retain the restoration in the prepared cavity, and occlusal the dovetail act as a occlusal lock. Okay. So main features of the retention is occlusal convergence and dovetail. Okay. So these are the primary retention means to retain the prepared cavity, prepared restoration in the prepared cavity. Okay. Now comes the convenience. Convenience form is the shape or the form of the preparation that provide for adequate observation, accessibility, ease of operation in preparation, restoring the cavity. So before starting off the preparation, we should be very careful that whether there is a convenience form. For example, if when you do a third molar, the rotator buccally placed third molar for the mandible, you will find very difficult because of the ramus of the mandible is very close. You cannot able to do a proper observation because of the it is a last to third molar. Secondly, you cannot able to access because tooth is tilted. So in that case, the convenience form is compromised. So we should be very careful. So you should be take care which type of material you should use in that case if there is a convenience form is not proper. Okay, so we should be very careful. So before starting up the cavity preparation, you should be very careful whether there is a proper convenience form. The convenience form is done for the adequate observation, accessibility. If observation means is it possible to visualize the prepared cavity? Accessibility means we have to access the instrument near to the tooth. Then comes ease of operation. We have to prepare the cavity and restore it. So if it should be very, so the convenience form should be there for a proper cavity preparation. Okay. Now comes the fifth step, that is, it comes in the final tooth preparation. So removal of any remaining enamel pit or fissure, infected dentine and old restoration. It is the removal of remaining caries or structure, remaining caries, tooth structure or faulty restorative material left in the tooth after initial cavity preparation. So if after the initial cavity, if the initial cavity preparation, if the tooth is if the old restoration is there in the, we have to remove it. We have to consider a lot of factors. Either we have to remove it, if there is any need for removal of the old restoration, because might be old restoration may negatively affect the retention or resistance. If there is a caries underneath the restoration, so we have to consider a lot of things, whether you have to retain the old restoration. So we are discussing old restoration may material to be removed if following conditions are present. Negative effect on the old new restoration. Okay. Then comes compromise the amount of anticipating, compromise the retention. If it is compromise the retention, radiographic evidence of secondary caries, pulp is the tooth pulp is asymptomatic. So periphery of the old restoration is not entered. In all these cases, it is better to remove the old restoration and do a new restoration. Otherwise, it will affect in the long run. The patient will have complaints of pain or any other difficulties, which will result in the failure of the restoration. So you should be very careful when there is an old restoration is present. Okay. Now comes pulp protection. Pulp protection is usually before, whenever you do the cavity, you should be very careful to prevent or injury or damage to the pulp. The primary function of the cavity is to protect the pulp. So you have to be very careful. So if the so you should be very before giving the restoration, you should take all the necessary steps to protect the pulp. So we will discuss about the cavity liners, base, varnish, and direct and indirect pulp capping. So cavity liners, there are three types of liners. That is glass ionomer liner, zinc oxide original liner, and calcium hydroxide liner. So all these liners are having different properties. So glass ionomer liners are usually given in a deep cavities where there is a when we are giving a composite restoration, whereas zinc oxide original or calcium hydroxide. Zinc oxide original has got an optident property. It will have reduce the pain. And also it also help in the formation of secondary dentine, and calcium hydroxide, which is also help in the formation of the secondary dentine. So the material should be used according to the clinical condition of the tooth. Okay, so there are three types of liners. One is in glass ionomer, calcium hydroxide and zinc oxide, which you know. All three material has got different properties. Now comes the base. Base is usually given under amalgam restoration because amalgam is a good conductor of heat. So if you give a restoration without base, the patient will have sensitivity to hot and cold food. So so you should be very careful that in case of amalgam, the base should be given. So in a normal case, the minimum thickness of amalgam is 1.5 millimeter and 0.5 millimeter for the base. So this base will protect from heat, from the cold and hot and cold food material. Okay. Then comes the varnish. The main function of varnish is to prevent the micro leakage. Yeah. So we usually give 2 or 3 coats of varnish. Varnish is given under amalgam restoration. This is to prevent the micro leakage. Okay. Now comes the direct pulp capping. Direct pulp capping is usually done when there's accidental pulpal exposure during the cavity preparation. If the exposure is less than 0.5 millimeter, we will give calcium hydroxide. We will give direct pulp capping. So we are placing calcium hydroxide directly over the pulp. So this will help for the formation of the secondary dentine, usually after 6 to 8 weeks. So this way we will help to maintain the vitality of the pulp. The second is indirect pulp capping. We are not directly placing. Indirect, we are directly placing calcium hydroxide, whereas indirect, we are not directly placing. Placing the calcium hydroxide. There is a layer of dentine. Above that, we are placing the calcium hydroxide. So that is known as it is indirect. There is no directly placing. So normally, when we anticipate the pulpal exposure, when we remove the layer of dentine, will result in the pulpal exposure. So in that case, we will give a layer of calcium hydroxide and try to protect or maintain the vitality of the pulp. Okay. Pulp protection. Okay.